Imagine being able to significantly improve your erectile function with just 1 minute of your day. Yes, you heard that right. 1 minute. If you're a man over 60 concerned about maintaining your sexual health and vitality, this video could change your life. I'm going to share a simple yet powerful exercise that thousands of men are using to regain confidence in the bedroom, improve their overall prostate health, and enhance their quality of life. You'll learn not only what to do, but exactly why it works based on medical science and research. Stay until the end, where I'll reveal a bonus technique that complements this exercise perfectly. This isn't about miracle pills or expensive treatments. It's about understanding your body and giving it what it needs to function at its best, regardless of your age. Are you ready to take control of your sexual health? Let's dive in. Have you ever wondered why erectile function often declines as we age? It's a question many men in their 60s, 70s, and beyond ask themselves, often silently and with a sense of resignation. But today, I want to challenge that resignation and show you that age doesn't have to mean the end of a satisfying sex life. The truth is, much of what we experience as normal aging when it comes to our sexual function is actually quite addressable. With the right knowledge and techniques, let me ask you something. When was the last time you thought about the connection between your pelvic floor muscles and your erection quality? Most men I talk to have never made this crucial connection. These muscles, which support your bladder, bowel, and sexual function, are literally the foundation of strong erections. And just like any muscle in your body, if you don't use it, you lose it. Think about it this way. Would you expect your arms to stay strong if you never used them? Of course not. So why would we expect the muscles supporting our sexual function to remain strong without proper exercise? This is especially important as we move past 60, when natural muscle loss accelerates. Now, I know what some of you might be thinking. At my age, isn't it too late to make significant improvements? I hear this concern often, and I'm here to tell you emphatically, no, it is absolutely not too late. In fact, men in their 80s have reported remarkable improvements using the technique I'm about to share with you. So what is this 1-minute exercise? It's a specialized form of pelvic floor contraction, sometimes called a Kegel exercise, but with specific modifications that make it particularly effective for men over 60. The beauty of this exercise is that it requires no equipment, no gym membership, and can be done anywhere, anytime, without anyone knowing you're doing it. You could be doing it right now as you watch this video. Here's how to perform it correctly. Start by identifying your pelvic floor muscles. These are the same muscles you use to stop the flow of urine midstream. Contract these muscles for 5 seconds, then relax for 5 seconds. That's 1 repetition. The key is to focus solely on the pelvic floor. Don't tense your abdominal muscles, buttocks, or thighs, just the pelvic floor. Do this for 6 repetitions, which takes about 1 minute. That's it. But there's a crucial detail many men miss. The quality of the contraction matters more than quantity. Have you noticed how many fitness programs focus on doing as many repetitions as possible? For pelvic floor exercises, this approach can actually be counterproductive. Instead, focus on the strength and completeness of each contraction. Now, let me explain why this works so effectively for men over 60. As we age, blood flow naturally decreases throughout our body, including to the penis. This reduced blood flow is one of the primary physiological causes of erectile dysfunction. By regularly exercising your pelvic floor muscles, you're essentially creating a stronger pump system for blood to enter and remain in the penis during arousal. Did you know that studies have shown that regular pelvic floor exercises can be as effective as medication for some men with erectile dysfunction? It's true. A landmark study published in the British Journal of Urology found that men who performed regular pelvic floor exercises showed significant improvement in erectile function after just 3 months. Imagine what you could achieve with consistent practice over 6 months or a year. But I want to be completely honest with you, this isn't an overnight miracle. Like any exercise regimen, consistency is key. The good news is that many men report noticing initial improvements within just 2 weeks of daily practice. Wouldn't it be worth 1 minute a day to potentially transform your sexual health? Now, let's talk about something many healthcare providers don't discuss enough: the connection between prostate health and sexual function. Have you been experiencing increased urinary frequency or nighttime bathroom trips? These common prostate symptoms often go hand in hand with erectile issues. The fantastic news is that the same pelvic floor exercises that help with erections can also improve urinary symptoms related to an enlarged prostate. Think about what it would mean to sleep through the night without multiple bathroom trips. How would that impact your energy levels, your overall quality of life? Many men I work with report that the improvement in their sleep quality alone makes these exercises worthwhile, with the enhanced erectile function being a wonderful bonus. I want to address another important aspect of male sexual health that often goes undiscussed: masturbation. Yes, let's talk about it openly because it's a normal part of sexual health at any age. For men over 60, masturbation isn't just about pleasure, it's actually beneficial for maintaining sexual function. Regular sexual activity, including masturbation, helps maintain blood flow to the penile tissues, which can help preserve erectile function. Have you ever heard the phrase "use it or lose it" applied to sexual function? There's scientific truth to this. Regular sexual arousal, whether with a partner or through masturbation, helps maintain the health of erectile tissues. When combined with pelvic floor exercises, you're giving yourself the best chance at maintaining sexual function well into your later years. Now, let me ask you a question that might make you reflect deeply. How much has concern about your sexual performance affected your willingness to pursue intimate relationships? Many men I speak with admit that they've avoided dating or intimate situations due to fear of embarrassment. Can you relate to this? Imagine the freedom of approaching relationships with confidence in your sexual abilities again. Beyond the physical benefits, there's something profoundly psychological about taking proactive steps to improve your sexual health. Many men report that simply doing something positive for their sexual wellness lifts a mental burden they didn't even realize they were carrying. Have you noticed how taking action on a problem, any problem, immediately makes you feel more in control and less anxious? Let's talk about timing. When should you do this 1-minute exercise? I recommend incorporating it into your existing daily routine, perhaps while brushing your teeth in the morning and evening. This habit stacking approach makes it much more likely that you'll remember to do it consistently. Could you commit to trying this for just 2 weeks to see if you notice any changes? Another question I often get is whether these exercises can help with premature ejaculation. The answer is yes. Stronger pelvic floor muscles give you greater control over ejaculation. Many men find that with regular practice, they're able to delay ejaculation and extend their sexual encounters. Would having that kind of control enhance your confidence and enjoyment? Now, I promise you a bonus technique that complements this exercise perfectly. Here it is: deep breathing while performing your pelvic floor contractions. When you inhale deeply, your pelvic floor naturally relaxes. When you exhale, it's easier to contract these muscles fully. By synchronizing your breathing with your contractions, you can enhance the effectiveness of each repetition. Inhale for 5 seconds while relaxing. Exhale for 5 seconds while contracting. This mindful approach not only improves the exercise, but can reduce stress and anxiety, both of which can contribute to erectile difficulties. Let's address another common concern. Is it normal to occasionally lose an erection during intimate moments? Absolutely yes, especially as we age. The difference between occasional difficulty and erectile dysfunction is primarily one of frequency. If it happens rarely, it's likely just a normal variation. However, if it's happening more than half the time you attempt sexual activity, then it's worth addressing more comprehensively. Speaking of comprehensive approaches, while this 1-minute exercise is powerful, it works best as part of a holistic approach to men's health. Have you considered how your overall cardiovascular health affects your erectile function? The blood vessels in the penis are smaller than those in the heart, which means erectile problems can actually be an early warning sign of cardiovascular issues. This is why regular checkups with your healthcare provider remain essential. What about nutrition? Are you aware of specific foods that can support erectile health? Foods rich in nitrates, like beets and leafy greens, can help boost nitric oxide in your body, which helps blood vessels dilate and improves blood flow. Wouldn't it be worthwhile to make some simple dietary adjustments if they could enhance your sexual performance? Let me share something that might surprise you. Stress management is as important for erectile function as physical exercise. When you're stressed, your body produces cortisol, which can interfere with the hormones needed for healthy sexual function. Have you noticed a connection between periods of high stress in your life and changes in your sexual performance? This is why techniques like meditation, deep breathing, or even just regular leisure activities can indirectly support your sexual health. Now, I know some of you might be thinking about medications like Viagra or Chalice. These medications have helped many men, and there's no shame in using them if prescribed by your doctor. However, wouldn't it be preferable to improve your natural function as much as possible? The pelvic floor exercises I'm recommending can be used alongside medication, or potentially reduce your dependence on them over time. Let's talk about expectations and progress tracking. How will you know if these exercises are working? First, you might notice stronger erections during sexual arousal. Second, you might experience improved urinary control. Third, you might find that your erections last longer. I recommend keeping a simple note on your phone or in a private journal to track these changes over time. Could you commit to noting any changes weekly for the next month? Another aspect of sexual health for men over 60 that deserves attention is communication with your partner. Have you had an open conversation with your partner about your sexual health concerns? Many men find this difficult, but clear communication can reduce performance anxiety and help your partner understand what you're experiencing. Remember, erectile issues affect the relationship, not just you. I want to emphasize something important. Seeking help for sexual health concerns is a sign of strength, not weakness. Too many men suffer in silence due to embarrassment. Would you ignore a persistent pain in your chest? Of course not. So why ignore issues with sexual function? Your sexual health is an important component of your overall well-being and deserves attention. Now, as we begin to wrap up, I want to return to our 1-minute exercise. The beauty of this approach is its simplicity and accessibility. No matter your current level of fitness, health status, or age, you can begin these exercises today, right now. In fact, why not try your first set of contractions as soon as this video ends? For those who have stayed with me until this point, I want to thank you for taking this important step toward improving your sexual health. If you found this information valuable, please hit the like button to help other men find this video. Also, I'd love to know what aspect of men's health you'd like me to cover in my next video. Leave the word strength in the comments below along with your suggestion. Don't forget to subscribe to the channel for more content. Focus on men's health after 60. The video appearing on your screen now dives deeper into prostate health specifically, so I recommend watching that next. Remember, it's never too late to improve your health and quality of life. 1 minute a day could change everything. Thank you for watching, and here's to your health and vitality.